Hey, folks, welcome back to another episode of Broken Brains with Bruce Parkman. I'm your guest and your host, Bruce Parkman, sponsored by the Mac Parkman Foundation, where we look at the issue of repetitive brain trauma in the form of repetitive head impacts in sports and repetitive blast exposure in our veterans, and what this exposure is doing to their brains in the form of mental illness and brain damage, and how it's impacting their lives. So, what do we have to do as a society to make sports safer, to improve the lives of these individuals as we go forward from a medical and psychological perspective? We reach across the globe, talk to researchers and scientists and patients and advocates, and do our best to make you, the viewer, more informed on this issue, as this is the largest preventable cause of mental illness in America, and we need to do more about it. Today, we have another amazing guest, Dr. Joseph Maroon. Dr. Maroon is a world-known neurosurgeon with extensive experience in neurosurgery and specializes in minimally invasive surgery to speed recovery for his patients. He's a sports medicine expert and an innovator, as well as an Ironman athlete. He's a board-certified clinical professor of neurological surgery, and his clinical and research interests have been in the areas of development of minimally invasive surgical procedures to the injuries, especially to the central nervous system, which is very important, what we're going to be talking here, and innovative approaches to brain tumors and pituitary tumors and other complementary approaches to inflammatory diseases, which is the most significant impact of these sports on the brain from a neuroinflammation perspective. And for the last 20 years, he served as a neurosurgical consultant to professional and collegiate athletes in football, baseball, golf, hockey, soccer, and was the team neurosurgeon to the Pittsburgh Steelers for over 40 years. He's been around the world. He's been honored, and it is our honor to have him as a guest on our program today. Dr. Maroon, thank you so much for being here, sir. Can't thank you enough. That's great. Uh, uh, I think we met a little bit. We met a little bit earlier this year. So talk about it here. The focus here: repetitive brain trauma, and we do not have a lot of positive ways to diagnose and treat this. Pretty severe outcome from people that have played sports or been in military service for a long time. You've seen this from every perspective. As an athlete, as a doctor, as a neurosurgeon, being on the sidelines. Why are we today at 2025 a society that still is pretty much ignorant of the risk of subconcussive impacts on the brain and the damage is done to our children, our athletes, and our veterans?
Well, I'd challenge you just a little bit on that, Bruce. I think we really do know quite a bit about it. When I started in the NFL back in the 80s, actually, as you recall, if someone had a concussion, the return to play criteria was holding up two fingers and ask the athlete, how many fingers do you see? If they said two, they could go back in. Well, we subsequently learned that much more had to be assessed. And that's in the 1990s. I, along with Mark Lovell, a neuropsychologist, were challenged by Coach Chuck Knoll to find out, if you want somebody to go back into a game, that's not the right test. I want objective data, he said. So we devised a test called the impact test, immediate post-athletic cognitive testing, which is now a computer-based test, also online. And we've tested now 25 million athletes, and it's still the standard of care in the NFL and all contact sports, including NASCAR, NBA, etc. I tell you that because Hippocrates, the father of medicine, said the first responsibility of a physician is to prevent disease. If that be impossible, to cure it, and if that too be impossible, to relieve pain. So what major sports organizations from Pop Warner to the NFL have been doing, because of our knowledge of the consequences of multiple traumatic brain injury, is initiating preventive measures, reducing the impacts, improving the equipment, improving and changing the rules. So we have learned a lot, and we're doing everything we can to prevent the brain injuries that do occur from contact sports. So, if your son goes out and rides a bike or falls off of a swing, there's danger of getting hit in the head and having a problem. In fact, for adults, falls are the most common cause of head injuries and disability. Falls in the home. So it's all about prevention, and then making the correct diagnosis when something does happen, and proceeded with appropriate treatment.
But Doc, we know that the largest issue here is subconcussive trauma. Okay. And the NFL and all of our sports leagues have not done, there's really nothing you can do with subconcussive trauma except prevent exposure. Yet, the NFL has made changes, or they don't do contact drills during the season, but most of our colleges do. All of our high schools do. And then when you talk about kids playing these contact sports at a young age, they're still strapping on helmets when their brains are they're just starting to develop. So how do we take what in the NFL, right? The NFL has made some good decisions. They obviously understand that subconcussive trauma is an issue because now they've shortened, the kickoff starts to minimize the collisions. They started wearing them crazy things on their helmets, which do nothing from a subconcussive trauma preventive standpoint because the brain still moves. So how do we take that knowledge that the NFL has gained and push that down range? Because subconcussive trauma is still impacting our kids, and we're not seeing the movement to go ahead and to reduce the amount of exposure. We can track it better. We are no more knowledgeable about concussions than we've ever been in the history of this country. Yet when it comes to subconcussive trauma, repetitive ed impacts, we are still allowing our children to get impaired. So how do we fix that? I mean, how do we get the NFL to go ahead and help us fix that?
Well, Bruce, again, I go back to society and to the thing called risk-reward ratio. Everything we do has some risk. Driving to work today in Pittsburgh at 15 degrees in the snow and ice was significant risk to me to get here in the hospital.
Right.
So there's a risk of me doing that. There's a risk to playing sports. There's a risk to riding a bicycle. There's a risk to riding a skateboard. There's a risk to getting on a swing when you're 5 years old or 6 years old. So it's balancing. What are the rewards of playing sports? What are the value of playing sports versus sitting at your home, eating Fritos, drinking Coke, and playing Playboy?
Oh, sir. I mean, I am a semi-professional rugby player. But when you drove to work today, with a possibility of you getting injured.
Correct.
When you put in a helmet, that possibility is 100% that you are going to suffer repetitive head impact as a child.
Yeah.
And that level of risk tolerance is unacceptable.
Yeah.
We cannot accept the fact that children are being injured. So how do we prevent that?
Well, how you answer that question? You don't let your kid play football if that's how
you don't let them play. You have flag football till the brain starts to develop. What is wrong with flag football till say 14, when the brain starts to develop, and then initiating brain contact? Is that something that we could all agree on?
The brain stop developing about age 25.
About age 20, about age 25.
Eliminate all contact sports.
No, sir. And there's no reason to eliminate contact sports. We're talking about making contact sports safer. I am 63 and I still play rugby. Okay. I started when I was 29. The point is critical brain structures, as you well know, the prefrontal cortex doesn't start developing till at least 14. The only sports that have severe tragedies in form of mental illness, suicidality, homicidal, and suicidal ideation are contact sports. Rugby, football, lacrosse, wrestling, whole 9 yards. We're not just talking for football.
Seals going 60 miles an hour over heavy waves that we've seen.
What's that?
Navy SEALs who are on boats going, the military as well. So,
I'm a retired Green Beret Sergeant Major who was diagnosed with general anxiety disorder as a result of trauma to my brain from thousands of explosions, being shot in the face, the 9 yards.
Yeah.
The whole thing is, Doc, is we're saying that, we're not, nobody wants to eliminate contact sports. We love our contact sports, but you have to make them safer. And the only way to make them safer is from an exposure perspective, not from sports. We love sports. We should have sports all over the place. But our children are being harmed because every time they put on that helmet, every time they check in hockey, every time they play these sports months for years. You have parents right now that have their kids in Pop Warner. They go to the play for the schools and they play for the town. And this is too much trauma. Even you must recognize this as a neurologist, that there is too much trauma that the brain just can't recover from. Right. And so it comes down to exposure. And the way to eliminate that exposure is to eliminate that mostly in practice. Save it for game day.
That's Pop Warner. You mentioned Pop Warner. The incidence of concussions is under 1% in Pop Warner, and the precautions that they've taken to minimize practice and to minimize concussions has been really, really marked. I mean, they've done everything you're suggesting.
They have not, sir. They're still practicing during the week. They're still the children
concussion. They're not having head impacts.
They cannot stop having impacts, Doc. They've got a brain inside a helmet that's shaking violently every time they get hit.
Bruce,
you cannot reduce that. You cannot eliminate that unless you just don't do it.
That's exactly right. Now, Bruce, do you know which sport has the most concussions? Rugby. Rugby. Now you're how old are you, Bruce? Well, you're a little younger than I am, and you're still playing rugby, having had multiple traumatic head impacts yourself.
Yes, sir. Yeah, but I started at 29.
Yeah.
Okay. The issue is that this is all preventable. Rugby, football, hockey, lacrosse, wrestling, all that. Okay, we have been groomed. The other day, I watched an NFL game that had a Nickelodeon commercial in it. SpongeBob and Patrick were on NFL talking about how great football is. When we know that football and all these contact sports to a developing brain is the greatest risk and the largest cause of preventable mental illness in this country. And it all comes from shaking the brain. So regardless of the sport, not just talking about football here, what are we going to do to eliminate that contact? That means flag football till 14 and getting Pop Warner off this contact drill and get them into flag. I mean, you cannot condone kids having helmets on with their brains in such a fragile perspective.
I'm not condoning it at all, Bruce. Do you know there's a significant incidence of concussions in flag football too?
But we're not talking concussions, Doc. We're talking about the repetitive subconcussive exposure of children. That's the concussions. We can heal from a concussion. I mean, a concussion is an injury, but we're talking about a lifestyle of subconcussive exposure that our children are experiencing from parents that are unaware that more is better. We're in America, right? More is better. So you're going to practice or you're going to play back-to-back sports. Yes, sir.
I think what's been done to date by the NFL, by Pop Warner, that I'm very familiar with, and the preventive measures that they've made, from my perspective, there's very little more significant things that can be done in terms of prevention. I mean, teaching coaches, they must pass a test now in order to be a coach. They have to recognize the problems. They have to be aware of all of these things. And then the only way I know the line we're going down is to eliminate the sport. Don't play it.
No, and that's not the case. What's wrong with flag? Definitely do not play contact sports when you're a child.
Okay.
What's wrong with flag football, Doc?
There are concussive injuries and flag
you cannot but it's not an inherent part of the sport. You don't get hit on every play.
That's right.
And I think we can agree that if we're going to value our children in what we know now, not back in 1980. I mean, Chuck Noll was one of the greatest coaches ever to coach the sport. No doubt about it. And we love our football. I mean, I've got tons. I got NFL players. I got rugby players. All my friends, man. A lot of them are suffering severely. The mental illness rate in the NFL right now is through the roof of retired people that are out there, retired players. And it's all because of exposure. If we want to make football if we want to even enhance football, which is a religion in this country, all these men, if they would have started at 14 instead of 6, and we could have changed, and we could have, just minimized the aggregate exposure, they'd be in a better place. You have done amazing things in the sport right now to make it safer. What But from a subconcussive exposure perspective, which is the actual risk, neuroinflammation, long-term neuroinflammation, and the damage it does to critical brain structures is the risk to what, our both our military and our athletic populations. And we just got to make it a little bit safer. The NFL is running down that road. Unfortunately, 99% of our high schools today have contact practices all week long. The NFL doesn't. They've set the example. Most of our colleges still have contact practices, unlike the NFL. And then if you go down to the Pop Warner leagues, they practice all the time. And so, to your point, we have been focused on concussions and their impacts for years. We need to look at subconcussive impacts, and we're all here to make our players and children safer. So I think, like you said, there's compromise in how we start and play these sports and what we can do. And there's huge advances, and you're on the top of them. What are the advances you've seen from a medical perspective that is addressing, the issue of some of the damages that the brain has undergone, or to help diagnose some of these players and get them back on their feet? Because you've gotten a large amount of players back on the field, haven't you?
I sure have. And I've also told a few, it's time to hang it up.
Good for you, because when it's time to hang it up, it is time.
Some very high-profile athletes that I've seen, I've said it's time to go. I don't want to go. Well, it's your choice, but it's time. You're going to end up with significant problems. So, again, I go back to the prevention, and I think probably, and again, reflecting on my rather long career, probably the most significant thing I've done in medicine after 15 or 20,000 operations is the impact test, which tells doctors you can't go back until you get back to your baseline in terms of your memory, your processing of information, your reaction time. Before, Bruce, as you know, athletes would go back into the game when their brain wasn't healed, when it was still inflamed, and less force, less trauma led to more damage. So by preventing that, and with the NFL, you have the blue tent. This past week, the Steelers against Cincinnati, the star fullback was pulled because he got hit in the head, didn't lose consciousness, but needed to be evaluated. Key player off, that's it. So I think that's part of the prevention. The other major advance I see coming, and here, is instrumented mouthpieces. And when I say, so what's the significance of that? So there's a company called Prevent Biometrics, started by a couple of neurosurgeons and a bioengineer at the Cleveland Clinic. And it's a mouthpiece, a mouth guard that everybody wears in contact, should wear in contact sports. It has triaxial accelerometers.
Yes, sir.
So it tells you, number one, where you got on an iPad or your iPhone on the sidelines. It tells you where they got hit, the G forces of the hit in terms of linear and axial rotation, and also the number of hits. So you have, from whatever age you start, if it's 14, you have a diary of every hit you've had, the G forces of every hit, and the location of that hit. This is now available. It's available. World Rugby, Bruce, to your credit and to your colleagues' credit, has adopted this now universally. So it's mandated that rugby players at the international leagues wear these. So you can see the cumulative hits. And you have, what a dosimetry badge is, an X-ray?
Yes, sir. I used to wear them for when I was looking for nuclear bombs during the invasion of Iraq.
So it tells you how much radiation you're getting.
Yes, sir.
This mouthpiece is a dosimetry badge for concussions. How many subconcussive hits you've had, the G forces of those hits, and I think we will get to the point where we say, hey, it's time for you to hang it up. You've had too many subconcussive hits.
And that's going to be an interesting conversation, Doc. Where do you think that range would be? Because like in dosimetry, I mean, there's an agreed to limit that, all right, you can only have this many rads per year, right? Once you hit that rad level, you can't be around the machine, you can't be in the environment. We're talking about sports, and this goes back to why we should be starting later in life, because if there is a cumulative amount that says, all right, you can't play sports anymore, we don't want that to happen in high school. We don't want to hit that limit in college. We want to hit that limit. We're in our 8th year or 10th year of the NFL, and we've got billions in the bank, and all right, I can go, right? And that's one of the aspects of starting exposure later on in life is we minimize damage to the brain, especially when it's developing. And then we also we create this gap where the brain can, while it's developing, gets less exposure. So when it hits that cumulative amount, they've already made their money. But I think that but those devices right now are only available at the teen level. You cannot buy them as a parent. You can't get them, you can't make those available. But I think that is a great start on understanding the importance of subconcussive trauma and tracking that. What do you think we've seen studies where, a high school football team, they've hit, 10,000, tens of, thousands of G-force, cumulative G-force in just one season a year. What do you think? Is there what can? And I'm not saying, I'm not talking about the amount. I'm like, do we have an idea of what that amount might be, Doc?
First of all, Bruce, let me help clarify things a bit. The data that you're referring to 10,000 hits and all this stuff, we're using accelerometers placed in helmets, which are now recognized as being very inaccurate.
Yes, sir. I understand that. Understand that. Yes, sir.
Okay.
Yep. No, got
so the hyperbole that has been used around that in quotes data has been very misleading.
Mm-hmm.
So that's why on a mouthpiece that's attached to your head, the accuracy is very accurate. And they've compared them to the helmets with these hyperbolic numbers to the mouthpiece. Huge difference.
Okay.
So we have for the first time accurate information. World Rugby, to its credit, has looked at hundreds of thousands of hits in rugby players. And they've established a threshold. For men, it's around 70 Gs. If you're playing rugby and on the sidelines, your trainer sees you had a 70 G hit, you're pulled. And this is World Rugby today. You're pulled and you're examined.
Yes, sir.
And they found individuals who denied they had a concussion because they wanted to play. But when they're examined and asked, what day of the month is it? Who are we playing? Who did we play last week? What did you have for breakfast? They've had a concussion. So they're out.
Well, right.
So, I mean, I'm trying to, put it in perspective for you.
I got it, sir. But for every 70 G hit, and I think the NFL standard for concussion, correct me if I'm not, is 90 or 95 Gs.
No,
is considered.
Let me clarify that 70 G hit. That's not a definitive figure. It's a number that you look at the athlete. You can get a concussion from a 35 or 40 G hit.
Okay, very important. No,
very, very important. If it's a rotation, what does it mean to have a glass jaw in boxing? It's the uppercut.
You can't take a hit.
It's the uppercut. You get hit in the jaw. Your head rotates up quickly. That causes actual rotation in the head and the brain. That can cause a concussion. And that's why that movement is more susceptible to producing a concussion. So,
okay.
Yeah, but we now have an accurate way to measure it. And that's going to be continually refined, but World Rugby is leading the charge in this.
No, and I mean, there's no doubt that we need that type of data. But when we have 170 G hit or even a 35 G hit, we also have all the other subconcussive hits that take place during
Right.
that time. And hopefully there'll be, one day this number that we can accept that is going to either, end a rugby player's season or possibly their career in the benefit of, saving their lives or enhancing their future. So those are a remarkable, that's a remarkable improvement. And
So,
how do we track this?
Bruce,
And we yeah, go ahead.
if I may, I know our time's limited, but I wanted to
Yeah,
bring something else up
yeah,
in terms of, so I'm all with you 1,000,000%. How do we prevent it? What can we do to make it safer? My whole 45 years in sports has been to do that.
yes, sir.
The other question is, how do we diagnose CTE? How do we diagnose the problem when we know CAT scans and general MRIs are normal despite significant neurological deficits? So I've been working with a brilliant neuroscientist from India by the name of Pravat Mandal, and we've published several papers now showing that in patients with mild cognitive impairment, Alzheimer's disease, and Parkinson's disease, there's a marked deficiency of glutathione in the brain.
Okay.
Glutathione is the primary antioxidant in the brain. So if there's a deficiency, and this has not been shown before, if there's a deficiency of glutathione, what does that mean? Well, what that means, are you familiar with free radicals,
Yes, sir.
oxidative stress?
Mm-hmm.
When you're hit in the head, when I'm hit, anybody's hit in the head, oxidative stress is a major component of TBI. Okay?
Yes, sir. Uh-huh.
So if what that means is your mitochondria take oxygen and glucose to make energy, ATP. In doing so, these free radicals, which damage DNA, protein, and fat, these free radicals are equalized with this is oxidation, and these are antioxidants. Glutathione is an antioxidant that squelches the free radicals and prevents brain damage. With me?
Yes, sir.
So, if oxidative stress is one of the main factors in TBI, what we intend to do and what we're doing with a grant from the Chuck Knoll Foundation, by the way, we're going to take a cohort of NFL players who have symptoms, behavioral symptoms or neurocognitive symptoms. And we're also going to take a group of Navy SEALs or other military personnel who have
I'll
had
go
traumatic
I'll
events.
find you all the Green Berets you need.
Well, Bruce, I'm telling you this for a reason. We're going to do this study. We're going to put them in an MRI scanner, and with the technique that's been developed by Dr. Mandel, measure the glutathione in the brain. We anticipate, our hypothesis is, just like in Alzheimer's disease, the oxidative stress from TBI is going to have a low glutathione.
No doubt.
So if the low glutathione is there, number one, that's never been documented non-invasively before.
Okay.
Number two, can we replace the glutathione and maybe have some therapeutic effect? Okay? So in Parkinson's disease, what's the deficient neurochemical, the neurotransmitter? It's dopamine
Okay.
in Parkinson's.
Yes, sir.
What is given to treat Parkinson's is L-dopamine, a precursor to dopamine, because dopamine won't get through the blood-brain barrier.
Okay.
Well, there's a precursor also for glutathione called gamma-glutamyl-cysteine. So again, I'm telling you this because we are going to be recruiting to the University of Pittsburgh for a IRB approved. We are submitting the IRB now, but we're going to be looking to evaluate. I don't know if you saw that article in the New York Times about the Navy SEALs in the high-speed boats
Yes, sir.
going 60 miles an hour over waves.
Shaking their brains.
You talk about subconcussive blows.
Absolutely, sir.
Bam, 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 bam.
Yep.
And
Just like rugby, just like football, just like hockey, it's bam, bam, bam. Yes, sir. Absolutely.
and these poor military, it's as you said, it's epidemic in terms of cognitive and neurobehavioral problems.
Yes, sir.
So,
well, I think that's going to make. When's that study supposed to take place, sir? Because that would be
we hope to do this beginning in February, March of this year. So let's you and I be in contact, okay?
Absolutely. That's going to be, because you're talking about addressing the number one problem that we have from what we call RHI or RBE, which is that neural inflammation, that toxic environment that degrades the critical structures of the brain and leads to those behavioral, psychological, and cognitive disorders that you're identifying.
You know better than I, there are 20 to 22 veterans a day commit suicide.
Dude, I know very well. And we're trying to address that. And part of that problem is we're not looking at that component of their military service. We're giving these guys a tons of drugs. They're mentally ill. You're the NFL players that we talk to all the time, they've got anxiety. They got a lot of disorders that are treatable, but they're not being treated correctly because we give them the FDA approved, here's some SSRIs, SNIs, whatever, instead of looking, hey, man, we got to address this toxic environment that's been created because of your dedication to the sport. So let's look at this. And that's what you're doing, Doc, is you're addressing that environment and making it better, which is going to have an enormous impact on these players. And hats off to you. That's going to be an amazing study. And I'll definitely, I'll definitely be reaching out to you on that to see what we can do to work together. And what else are you saying? Now you're heavily involved. Were you heavily involved with HBOT, or did I see you at the?
That's the other thing. I really would urge consideration. I've seen personally a Navy SEAL who was in Iraq for destinations and one in Afghanistan. Yep. He was a breacher, and
lots of exposure,
and just hundreds of, and he taught breaching, and really significantly affected with PTSD and post-concussion syndrome. Very significantly, and he was treated at the Aviv Hyperbaric Center in the Villages in Florida, and really a very dramatic response to that. And the scientists there, one is another neurosurgeon, Amir Hadani, who's a brilliant neurosurgeon, have written papers and published peer-reviewed articles on the treatment of PTSD and post-concussion syndrome with hyperbaric oxygen therapy. So it's something that the government and the insurance companies will pay for hyperbaric oxygen if you have a diabetic wound, an ulcer that won't heal of your foot, or a fracture that won't heal of your extremity.
Wow.
They're not covering wounds of the brain. And it's wounds of the brain that I think also hyperbaric oxygen therapy has tremendous value. And again, when used properly, the right number, the right atmospheres, and hyperoxia. So again, these are areas of, I think, improvement that can really change people's lives.
Oh, absolutely. When we met, we were with, an NFL player who's absolutely said his life was, changed from hyperbaric oxygen, photobiomodulation, all these non-FDA approved modalities that are out of pocket for everybody in this country. Yeah. And your comment that insurance will only pay it for this, but not for the brain, is one of the problems that I think we need to address in this country. Is that we know that we create these toxic environments through sports and military service. Okay, nobody can doubt that. The science is there, the research there, no problem. how do we make this better? And it's not drugs. It's treatments like you're talking about, innovative treatments that are coming in with new technologies, new modalities, different uses of common nutraceuticals or whatever to improve the brain health so that the damage stops. And of course, hopefully the individuals stop beating their brains around too, right? That doesn't hurt. But sometimes when we're in the middle of our NFL career or we're an active duty service member, there is no stopping. Okay, we still got to do our time. We still got to play our game. All we can do now is focus on making this better. And it's efforts like yours that are doing that. And that's what's important to our viewers to know that if they are that kid that started way young and he's in his 30s or 40s and he's got psychological or behavioral challenges, well, you're not crazy. To your point, that nobody touched you when you were a kid. You have a damaged environment that needs to be addressed. And there's new ways to do that now. And that's what we're hoping, that, doctors like you can succeed in not only providing these modalities, but now we got to work with, and just so you know, Doc, I mean, TBI is now listed as a chronic condition, right? So now, TBI and especially repetitive exposure to TBI from contact sports and military service should now allow us to start covering under the TBI billing codes, HBOT, photobiomodulation, some of these other, like you're talking about nutraceuticals, right? Precursors so that the body can naturally develop chemicals that can get across the blood-brain barrier and improve the brain health of their individuals. So we're hoping, are you having any luck with these, getting any kind of coverage for brain health under the TBI codes or super billing or anything like that? Have you had any success? Because a lot of people.
There are a couple of states. I think Florida is one that's going to be leading the charge, Kentucky and others who are approving it for veterans.
Yes, sir.
We start with these guys. I mean, you're people like yourself who while I'm sitting here in a free country, able to express whatever opinion I want, due to
Right.
people like you and myself, I served as well. But my heart goes out to these veterans that I meet who, I mean, look at the recent catastrophes. This fellow, recently in
Yes,
the
sir.
news.
Clearly, yeah.
Yeah. I mean, it's tragic. And
thank you for your service, by the way.
yeah.
But he's been, as we find out more and more, this gentleman, and I'm not calling him a gentleman, but this person who blew himself in that truck is representative of a lot of veterans out there, not just special operations guys either, that we find that we deal with that need better treatment. And that's why talking to you and figuring out ways not only to help, our athletic population, but our veteran population they've done nothing wrong. These kids joined the military to defend us, right? I've been retired 23 years, right? These kids joined after I retired, right? And their only crime was they did what we asked them to do.
Yeah.
And now they're out there. Everything's out of pocket. We know soldiers right now that are mortgaging their homes to get hyperbaric oxygen treatment, to buy their own tanks, to go the psychedelic pathway, to do anything to improve their brain well. So definitely want to stay in touch with you on that, on the billing part of that, because it's
a day take their lives because of.
We lost the estimates right now. We lost a little under 10,000 kids in those two, in my opinion, unnecessary wars. We've lost 130,000 plus to suicide. And it's because we have not changed how we deal with mental illness. And we have to look at modalities like you. Now we might disagree on when you can start playing contact sports and the impact of contact sports, but I think we can all agree that we need to do a better job when we have patients that are suffering either from, repetitive impacts in contact sports or repetitive blast exposure. They need better treatment. And the treatments are there. That's what's killing us, Doc, is that treatments like yours are available. If you have money, right? And that's the paradigm that we're trying to shift right now, is that we understand that, hey man, you played a lot of sports, man. Or you played a lot of, you were 22 years in the military, whatever it is, right? Now we got to get you back. We got to get you back to your families, get you back to your friends. And you are doing an amazing job at helping these men and women get back. I mean, yeah,
I'm an octogenarian, so I have you by a few years.
just a couple, sir. Yeah,
And
I'm hoping to get there. There's days I doubt I'll get it, but good to you for
the
helping.
number sticks in my throat, so I have to say octogenarian. But it's what's really motivating me now, the conversation we're having, and what I see in terms of the mental health crisis at
Absolutely.
every level,
Yes, sir.
at all levels, and how we have so little knowledge of how the brain works. How do you, Shakespeare said, how do you pluck from memory some rooted sorrow and erase the written troubles of the mind? And pluck from memory a rooted sorrow. When this gets encoded into our emotional system, our amygdalas, uh, it, very little can erase it at this point.
Yes,
But
sir.
anyway, we get off on tangents, but
Nah, it's
I
great. I
applaud what
just
you're doing, and we're on the same page totally in terms of prevention, and also, what keeps me really motivated. I can't wait to get to work each day, because of what I see are just horrific consequences of emotional and traumatic brain injury.
yes, sir. No, we know that the leading indicator, that the only thing we have to know that the brain's being harmed right now is that mental, cognitive, or psychological state, because we can't see in the brain, and you're helping us deal with that, and it's amazing what you've done, Dr. Maroon. As we close out, tell people how to find you. What's next? I mean, obviously we got the study. How do they find out about the Aviv Clinic and the amazing work they're doing down there? Where would they go?
The Aviv Clinic, it's online, avivclinics.com. And in terms of hyperbaric oxygen therapy, I can be reached through them. I'm online myself, josephmaroon.com, my website, contact information. I applaud what you're doing and getting information out to those who really need it. And you're obviously very passionate about what you do as well. So we're
Uh,
we're brothers in that regard.
Yeah, we are, man. And I can't wait to see you again. I live close by, so I'll be out there. Dr. Maroon, thank you so much. Congratulations on your amazing journey, your amazing career, and what you're doing for those that have been affected
And
by
you too.
repetitive brain.
Thank you, sir.
All right. Thank you so much, sir.
All right.
For the rest of our viewers today, thank you so much for another amazing podcast. Don't forget, go to the website, download your free book, Broken Brains, read it so that you're informed. Follow Dr. Maroon, man. He's on the cutting edge of helping our brains get better. Thank you so much. Till next time, Bruce Parkman signing off. Take care.